Well, we're in the game.
Hello, everyone. It's Diane, the massage mentor, live here with David Morin. He's back for a second appearance, and I'm very, very excited about it. Hi, David.
We did it right this time.
How are you?
Really well, Diane. Thank you. So nice to be with you again.
Well, it's so nice to be with you.
I had good fun.
And I wore this special shirt for David.
Yes, indeed.
Because we love the saying, cool beans. So are you ready to get started?
I am ready to get started. I'm always ready to get started with you, for sure.
So you've been teaching since 2001, and I feel like I'm pretty clear on your mission with your teaching, but could you please give us your mission and explain a little bit more in your own words? Last interview, we're going to hone in a little bit more on some things with you. So
You know it. Thanks. That's a good way to start. Well, it's true. I've been teaching medical massage therapy formally as an approved provider with the NCB-TMB for, since 2001. After 2 years of being licensed in 1980, we started a class called Stress Reduction and Creative Relaxation at the local junior college. And we got a lot of clients out of that. We taught it for several years. And then in 87, here in New Mexico, we started the first school in southern New Mexico, the first massage school in southern New Mexico, in Ruidoso, New Mexico in 1987. And then my partner, Juanita Thompson, we divorced in 1990. She continued the school for another 23 years. So that's what she's bringing to the training that we now co-teach. For me, Diane, it's about a thirst for knowledge, I love knowledge. I've been to 4 undergraduate schools and 4 graduate schools and got degrees just about every time. And you know what I mean? And so it's been that. So when I entered this work, I never would have dreamed that everything that I had ever done in my professional life would have helped me as a massage therapist and certainly as a massage therapy teacher. This is my 5th career. At age 36, I started my 5th actual serious job or career, and it's proven to be the one. So that thirst for knowledge has led to an interest in teaching. And you know, as a massage therapist, I heard many times, and I know you have, and people in our audience hear it all the time, that was one of the best massages I ever had. And that's a lovely thing to hear, isn't it? It really, really is. But you know, after starting these courses and becoming a specialist and converting my practice into a specialist practice where I was literally the go-to or the expert in the area, and I wasn't doing full body massage anymore at all. I gave it up. I moved on to become, you know, in the medical field, we have generalists who are principal providers, and then we have specialists. So there's nothing wrong with being a specialist in massage therapy of a certain market. Could be geriatrics or oncology or whatever. And I chose musculotendinous, musculoskeletal injuries because that is my interest. And in doing so, I found that people would come out of a treatment and say two things that were often said. One was, you know, I've had massage in a dozen countries and no one has ever done that. And I like it. So that's what I would hear. And I would say, wow, that's interesting. I didn't know. I hadn't been in 12 countries to get massage. They had. And the other one was, I had people come out and say, 4 visits with your approach has helped me more than 4 months of that other therapy, whatever I was doing. Whoa, well, that got my attention. And so opening up the teaching practice and traveling and teaching medical massage therapy since 2001 has been even better than being in practice. Because it's lovely to have a client come back and say, you know, my shoulder does things it never could do, and thank you. It's even more meaningful to me when a therapist like you, with someone with experience, a real pro. I mean, you don't get to have a champion establishment unless you know what the heck you're doing, and you apply yourself all the time, and you're serious as a heart attack about what you're doing and evangelical about your work. So that's exactly what I am. I am you. You are me, literally. Get used to it. It's true.
And,
So that's where I'm coming from. And I bring to the table or to the classroom an evangelical certainty. This work can help clients and extend your career. So that's, in my own words, what I'm bringing to the teaching of the work that I do.
and that was like so intensely beautiful. It was so well put. I really enjoyed listening to you, and it's starting to get me
I
now.
can't help it.
I'm getting fired up already. And one
Good.
thing I want to point out too is just to see like one of the fruits of your labor is too. We had Maria Natera on
Natera.
Natera on like
Natera.
Natera.
Yes. Lovely Maria. She's awesome.
Sorry, Maria. Natera.
She's awesome.
And she's actually one of your students. So I just wanted
She
to
was in our
acknowledge.
second massage class in 1988 in Ruidoso, New Mexico.
And she's tearing it up, and she says wonderful things about you. So I just
She
wanted to,
is wonderful.
I just want to throw that out there, that the word is on the streets that you're a remarkable teacher.
The word is out.
And so one of the things too that I think I wanted to focus in on a little bit with you, and we want to talk about is too how some of the work and the techniques that you've created can help alleviate burnout and kind of keep therapists going.
Well, it starts with the fact that I started at age 36, so now I'm 77. And along the way, I aged. I just can't believe it happened, but one day I was older. And as I've aged, I found out that my full-time work, I've always been a full-time therapist, never had another job since 1978. My thumbs gave out, and I had a back injury and a variety of things. Do I want to continue this? And I did, because I was teaching. And I didn't want to be necessarily in a full teaching practice if I wasn't in a therapy practice too. So I literally reinvented myself as a therapist, but I didn't tell anybody for a couple of years. And then I realized, David, if you're going to be honest about this, you have to present to the massage therapist exactly what your practice is like. That's what I was doing before. So I literally cleared the boards, took all the pictures out of the manual, put new ones in, no thumb work, seated client, clothed, a seated therapist, clothed client. My client would be wearing a t-shirt and a pair of shorts or a pair of sweats or a pair of board shorts, as we say in Hawaii, long shorts, comfortable, sweats, whatever. And they would receive a specific treatment for their carpal tunnel or their cubital tunnel syndrome or neuralgia paresthetica, whatever it is, then they would receive specific work from a seated therapist using all manner of treatment techniques other than thumbs. So that's what my approach is exactly what I've been doing for myself. And now I hear from my students that, I had a 75-year-old therapist tell me not long ago, David, I think I can make it 10 more years.
Aww.
And she did.
And that's why I think too, one of the things that I think people really relate to, and you have such a big following, is because you are really passionate, because you get moved when you speak. And another thing that I love, and I just want to point out about how cool it is that you evolved with your work, and your teaching has evolved with your work. So you're you are exactly where you are, and you're bringing that to therapists, and
Exactly.
and honestly, without any holding back. And I don't know about you, but for me, in the beginning of when I started teaching too, I was a little hesitant to give all the goodies away. You have this like, is my stuff good? Is it going to work with other people? And you get kind of nervous. So it's brave. It's brave to share everything that you're doing with people without hesitation. Would you agree with that? I think it's brave.
I would agree with that 100%. And I suggest to you that someone who hasn't taught wouldn't know that, maybe wouldn't even think of that as a possible tendency on us to think, I really shouldn't show them everything. They don't really deserve to have it all, do they? But then at some point they did. And you know what? The beauty of it for me, and I trust for you as well and others, is that when I became really clear and really honest with exactly what I was doing, like I don't use thumbs anymore, but I did something else. I created some tools that can take the place of thumbs, and I'd like to show them to you. I didn't have them
Do it.
last time.
Yeah, that's
But I do
awesome.
now. So whenever you want to, I'll show them to you as well.
Show
But
them to me
I
now.
am prolonging my career, and I'm helping others too.
Show me the tools.
Show me the tools. Right. Well, anyone who's had neuromuscular therapy training with Paul St. John, these are the tools that I received from Paul St. John in 1978. 1978. Notice it's one and then the other one. Well, they were basically unusable because even with my big hand, I can't get to the end of that thing to have proper control of it. It's uncomfortable. So what I did, I got together with a woodsmith and created solid oak, solid neoprene tips, much shorter. This fits into the hand so nicely, right there. Fits in very nicely. The fingers can be there to guide the tip, and it's really nice for doing pressure. And that's the thumb saver. And then the bevel, there's the bevel one right there for getting into that lamina groove. And I even created a third one that has a rounded green tip. This is solid neoprene rubber, no latex, and solid oak. So that's what I use, and that's what it's only for my students.
And
my students get this. So I say that so that someone doesn't say, where can I get those? No one but our students can get them.
that's cool. And the oak tree too. I'm excited about the oak tree being the wood. That's a beautiful wood. Oak.
Indeed.
Oak. It's beautiful. It's strong. Indeed. And I'm getting a little off track, but I think it's a valid off track. I know. So when I train new massage therapists and say we're showing them how to use, their elbow, and they're like, well, I can't really feel anything. I don't know where I am. And I say, well, just be patient. Pretty soon your entire body will almost have eyes. You'll get to feel things the more that you work with the different parts of your body. So I know sometimes people are like, I don't use tools, but for me,
yeah,
I'm guessing, especially after talking with you and just and admiring you like I do, I remain open, and I think that's how we stay successful, right, David? We remain open, we try different things, and then we share what works for us, and then the people that it works for them come to us. But that tool, I'm guessing too, the more that you use it, the more it almost becomes an extension of yourself. Is that how you would describe it?
100%. You're right on once again, because the mind is like a parachute. It works best when it's open. And I've had many students say, oh, I wouldn't use a tool. Oh my gosh, I use my hands. I'm a therapist. Plus I can't feel through that. Oh, really? Well, that just means you haven't tried it. And what I've had people do, just try it, just do it. And they actually go to class or go to their client and just like I have, and use the tool and go to my thumb and prove to them. I prove to them in class while I'm working on someone's back. I'll be using my thumb and then switch to the tool and switch back and say, which one am I using? They can't tell. If it's properly applied, they can't tell. And the same way with forearm. Now, on the elbow aspect, I don't ever use or teach the point of the elbow, but it's the forearm.
Right.
And you can teach. You can school your body. If people can do long distance kinesis and say, hello, I can feel your heartbeat from here, and he's in India. Well, I think I can feel through my forearm. Hello. This is not rocket science. This is mechanoreceptors and nervous system. Hello, wake up, and yes.
And it takes, but the one thing that I would say, in all fairness, is it takes time. I mean, it takes time to become one with to use our body as a tool, and then to add tools to our body. This art takes time, and
repetition is the mother of skill.
And actually, I'm going to get off track one more time with you, David. Can I?
Repetition is the mother of skill in everything.
Yes, so technique takes time too.
Right.
Learning all techniques takes time.
Time takes time.
Time takes time.
Someone said that. I can't think of it.
I can't remember who said that. Time takes time. Okay, so medical massage too is almost, you were saying earlier, it's more of a focused work. But one of the things, again, that I kind of liked about your explanation in the videos that I watched was it is focused work, It is maybe working on one area, but it's not this robotic thing where you only do this way and it has to be in this order and all that. Your teaching is, we'll focus on this area, but based on how the client feels or what the client needs, our approach might vary. You don't have to be like, I do medical massage. It's an art.
Indeed. It's the furthest thing from robotic. In fact, I saw your word robotic there in the notes, and if anything, it would seem to me that a routine, unchanging Swedish massage would be robotic. It was robotic for me. My client listening to Pachelbel Canon, I'm doing the treatment, and they're snoring or got their eyes closed, and they're otherwise they'd sit up and say, "Oh, don't press there, that hurts," and right back down and close their eyes. Wait, what am I doing here? What am I doing here? I'm just your servant, so to speak. I don't know. I didn't like it. I didn't feel like I was being, it didn't hit my skills. So completely different than that is clinical massage therapy. The sameness is the approach. We always, always, always use the same approach. We always take a history. We always assess. We always treat. We always reassess. And by the way, assessment doesn't mean touching the body and finding out just that. It means with active range of motion or passive range of motion or manual resistive test or a variety of approaches to evaluate and assess. So it's way different than robotic. In fact, the sameness is the protocol that we apply, but the difference is the difference between that client and this one coming in. This one's coming in with leg and foot issues. This one has a neck and jaw. So totally different. Totally different. And the beauty of the liberating aspect of it for me is that I gave myself the permission to be a specialist, to say, today, I don't need to be providing with you with that wonderful full body massage, which often in medical circles is exactly the treatment that's needed. And if in fact I send people out for fibromyalgia work or a variety of other things, I send that out. And I remain the specialist working with the individual conditions. And that way, by the way, when I'm asking massage therapists for referrals of their specific cases, they don't ever think that I'm going to take their clients because I don't do full body massage. Their client will go right back to them after they've seen me for 2 or 3 times.
So they work together. And so that would add into your idea of kind of getting away a little bit from burnout. It would be, kind of, it is a little bit different every time. You're doing different parts of the body and you're focusing on certain regions. So it's not as physically exhausting, I guess you could say.
Indeed. The ultimate example of that would be a call I had one time by someone who said, I would like to take your courses, but I'm just getting out of the profession. I've got a herniating disc in my back, and I just can't continue to do that full body and get around, and especially they want so much pressure. It's hard on me, she said. And I said, guess what? The class that's coming up, and she called me about a specific live class some years ago, and I said, the class that's coming up is head and neck. Take that class, even if you just take that one class, and then give yourself the permission to be an expert or a specialist in neck and jaw. Sit down on a stool, have neck and jaw clients come in. You're seated. You're doing gentle work on head and neck and jaw. You could do tremendous amount of service because number one, who spends enough time on the neck anyway? Nobody. Who knows how to give a really great neck treatment? Not many. You know what I'm talking about. Not many. So she said, you know what? That's a wonderful idea. So that's the idea that I'm presenting to folks.
That is so smart. Too. Yeah. I like how you are. You really are helping people have a little more longevity by having a focus on different parts of the body that they are able to work on instead of just going, oh, I can't do this anymore. I'm going to quit. Because so many of us are in it with our whole heart and our whole being, and it doesn't have to be that way. So, exactly. So tell me too, another way, one of the things too that you said that the kind of body work that you're promoting, it kind of, will help with even saving a therapist's neck.
Well, yes, I'll comment on that, but I also want to make another comment too about your question about the sameness of things, the same technique or the same technique on different people. Absolutely not, because not only do we have the regularity of the assessment and test and so forth and treat, we're treating not with just one modality, not just with one approach. We've got many, many things. I'll give you an idea here, just out of my little brochure to the class. We're looking at gliding and stripping, skin and deep cross fiber friction, percussion vibration, trigger point therapy, Nemo work and Logan basic work, myofascial therapy, muscle energy technique, active engagement, skin rolling, osteopathic oscillation, joint mobilization, pin and stretch, and more. That's the kind of things we use. We want us to be able to draw from whatever technique we need. So we don't have one. I'm not a clone of any one.
Yes, that's what I'm talking about.
That's what I'm
Love
talking
it.
about.
That's what I'm talking
Now,
about. I
the
love
neck.
it.
The neck, as with any part of the body, we want to suggest to our client always that they practice active range of motion. In the next case, it's the 4 movements of the neck and then changing the angles. For instance, with the neck, in addition to the 4 simple movements of the neck, we have looking down at an angle this way and then letting your eyes go up at an angle to the far oblique angle, like an X crossing, and then come back down. That would see crossing the normal ranges of motion, you might say, by expanding that, because the neck is so useful, so ubiquitous in its motions.
So I think let me just go backwards. So
Sure.
I know that you had shown me some cool neck stuff, but I'm talking more too about like the massage therapists themselves. I mean, you're helping save their thumbs, their hands, and also one of the things that you mentioned is their necks. Like the whole body, by doing this work, the therapist can benefit. Do you want to talk any more about that, the benefits for the therapist performing the medical massage?
Well, I would say to you that in my experience, if there is one thing that is lacking in our industry on the part of us as massage therapists, is that we are caregivers. We are so good at giving care to whom? Our clients. Guess who we're not very good at giving care to? Ourselves. And I'm telling you, as a teacher over the last 20 some years with 40 years, I have seen the physical fitness of massage therapists not go up, I'm sorry to say, but it's deteriorating. People are so focused on serving clients, being a humanitarian, and being of service, and also paying the bills, that we as therapists tend, and I own it myself, we tend not to do all that we could be doing to take care of ourselves. We can talk the talk, but damn it, we sometimes just don't walk the walk.
Yes.
It's a fact. I can't.
It's so true.
It's so true. I see so many students coming to class and they're out of shape and not able to do a lot, which is what my message is to them, to possibly change their working manners and techniques, and being seated and working on one area is different than doing a deep tissue massage on every area of the body. After all, it's not near as fatiguing, but also to take better care of ourselves with our own range of motion, because we know we teach our clients that if you don't use it, you're going to lose it. And that's true for us. So yes, we have to focus our own good stuff on ourselves as well. And we have a lot of work to do there. So that is my exhortation to myself, to you. And I think every clinic like yours with a dozen therapists or so ought to have some, could possibly have, not ought to have, but could possibly have some regular
Heck yeah.
care.
They all get massaged here. I feel like for me,
No, I don't mean just getting massaged, but I mean doing their own self-care, because active range of motion is active and it's making the muscles work better.
I have to say, and I'm jumping around just a little bit again, but
okay.
I mean, last time we talked, I told you, oh, my neck was bothering me just a little bit. It's been like this ongoing thing. So you said so I literally, that's all I've been doing.
Well, that's one of the 4 motions of the neck.
Right. Just one. I understand that. But just doing that one consistently.
Is that all I gave you?
You gave me a couple, but I've been mostly just doing that one.
Oh, you were doing one. Okay, that's typical client.
So, but still, look at me. Look at that.
Yeah.
So
Yeah.
moving, and I just, those simple movements, and I think you were showing me, did you show me this?
Oh, you're
You
doing
showed me
lateral
this.
flexion as well, and then flexion and extension. Very good, Diane. You're a good student as well as being a good teacher.
Thank you.
Now
Thank
do
you.
them. 4
But I've
motions,
been mostly, this one's the one that's really, just that simple. I know, I'll do them all, David. I'll do them all.
and then tucking the chin. Put your finger right here on your chin and tuck your chin, because our heads get way out there like that.
So far out.
Outgoing. You are, I am outgoing, and we need to push that right there.
I love that. I like that. We are outgoing. Push it back right like that. I always say a lot of us lead with our heads. Everyone walks with their head forward. I'm like,
every inch of
everyone's so
forward head
busy thinking.
posture add 10 pounds to the weight that the neck muscles must support.
Yep.
10 pounds per inch.
So I have my exercises. I've been doing them, and I just want to say that they really do work. You would think after all these years, sometimes the gift is right in front of you, and you just keep going around it. But so thank you.
Oh, yes.
Thank you.
Oh, the teacher's in the room for sure. No question. The teacher's always in the room. The question is, am I paying attention?
Right. It's true.
Am I paying attention?
It's true. And so, do you have any other any hot topics you wanted to cover, and kind of going on in the industry? Anything you want to bring to the forefront? I mean, we've covered a lot of ground. I hope everybody's enjoying this.
Well, let's see. Yes, I'm ready for you. There's a lot of hot topics going around. One for me is the self-care of massage therapists, and the reality that certainly that a person has another option other than hanging up their massage lotion holster and giving it up by switching to becoming a specialist. That's a great idea, by the way.
It really is.
Also, probably the biggest burning question in our profession is these days, that's come up the last couple 3 years, perhaps maybe, is talking about evidence-based therapy. And we're hearing a lot about that. And I've been hearing things in the last 2 or 3 years, something like, if you don't have evidence, meaning a research study for what you're doing, you shouldn't be doing it. Or if you're still doing what you were doing 20, 25 years ago, you're probably out of the loop and not valid or not contributory or not relative anymore at all. So hang it up or get with it. And I'm telling you, Diane, I do not agree with either of those statements in the least. They hold no water for me at all. Because, number one, the definition of evidence-based therapy, there's 3 components. One component is clinical expertise or clinical experience, like what you have or what I have. We have clinical experience of working in the field. And then we combine the clinical experience of the authors of the books that we read and the courses that we take. And all of that combined is clinical expertise or clinical experience, one component. Second component, the client's characteristics, their values, what they value, what they see as relation. If they don't believe they can get better, they can't get better, can they? You know that. And the third component, third of 3, is research, actual research. Well, it turns out, Diane, that a little bit of study into this area has led me to understand that, as if I didn't know already, that massage is not easy to research, because you take one component, like whether the pressure on a muscle does good. And you study that one component, but that doesn't say anything about the client or the attitude of the therapist or their background or what kind of intention they put into that one thought. So in one technique. So it's erroneous. And the idea of evidence-based practice is a combination of things. And we want to be relatively aware of research that is relevant, but there's not much of it. There's not much research that's relative to massage therapy.
Can I share one?
Please.
So one of my teachers, Master Ohashi, who I love, I'm going to change the story up a little bit because it's a little, But one of the things he said is, when someone takes my blood pressure, they take my heart, blood pressure. Now,
Yeah.
if my doctor brings me a very pretty nurse, he says,
Yeah.
my heart might be pounding really hard. He said it really depends on the environment, everything going on. And if they
Absolutely.
just at that one particular moment take my heartbeat when I'm thinking, wow, what a beautiful nurse, and I'm sweating, he said, well, that's not necessarily an accurate reading. There's so many things that go into that. And
Exactly.
I think that's exactly what you're saying. And I love
Exactly.
that point. It's like one person, one human being is so complex. I always like to say, I see my client, even if I've seen them for 10 years, I've seen them 1 hour a week. I mean, I know them, but I don't know what they do when they leave my office. And I think that too
Indeed.
is kind of wrapped into what you're saying.
Indeed, it does. And also, in point of fact, in the clinical sense, if you are my client, and each time you come in over 10 years or whatever, and every time I assess, I have you do active range of motion, and I make notes and I document all our sessions. That literally, Diane, is client-centered research, because it's a case
Yes.
study. And if I've been in practice for 40 years, as I have, 41 years now, I've got thousands and thousands of anything you want to name, almost, especially carpal tunnel and TMJ and things like that. Some of the things are a little bit unusual, but there's a lot of repetition. Golfer's elbow. Well, what have I done for golfer's elbow and been successful? Let's go back to that. Let's do that. Didn't work on this guy. Let's try something else. He tested different. Let's do something else. Let's do something else. Let's try this. Keep going, and you've got an inexhaustible number of approaches. And if the client's willing, point of fact, I tell clients who come in who say, well, where have you been for therapy? Well, I've had a dozen chiropractic adjustments and 2 months of acupuncture, and I'm now here seeing you. And I say, so I get one chance? Oh, well, no, I would be willing to give you more than one chance. So my comment is, my statement is that please give me 3 chances. In 3 chances, you'll
I like that.
You'll either be turning the corner, even just starting to turn the corner, and we'll both be enthused. Or if we haven't made a dent in 3 sessions, then it might be time for you to mention it to your doctor, see what your physician says. They diagnose. I'm not diagnosing you. I'm evaluating you. I have no idea what the diagnosis might be. So go get that, or try another therapy, go back, try something else. So I say, give me 3 chances.
I like the 3 chances, David. That's very cool.
That's the way I got there, because they would come in and say, well, I've had all this other stuff 10, 12 times. And I got to thinking, well, do I get one chance? Is that all?
One of the things too, I always imagine is, the first time you dance with someone, the first few minutes, it's kind of like you're both like trying to figure out what's going on. And for me, I also see that with my work. The first time I meet someone, I can't be like, I got your body down, I know all about it. It's like it takes a minute sometimes too to like get acquainted, and for that client to, so
exactly.
What else do we have? I think we've covered a lot of ground.
Give me your list, please, because I'm loaded for bear here on all your top topics.
We have, what else do we have? We talked about saving hands, thumbs. We talked about, let's end with this one, because I think this is a good one. What is your favorite part of the body to teach massage therapists about and to work on?
Well, the formal answer, of course, is that there is no favorite part. Every single part of the body is relevant to other parts, and also in injuries. They come in with something that they'll need to be treated. I did give it some thought, though, and I have a couple of responses for you, because I knew I'd want to have something for you. An area, I want to take an area that everybody works on, but nobody knows how to work it well. Very few know how to work it really well, and that would be neck and jaw. Neck and jaw is a favorite. I'm going to say it a favorite, because everybody knows that the neck needs work, but it's so complicated, so many muscles, that it's difficult to really get a thorough job going. And now, today, it's particularly exciting because of this new diagnosis that we didn't have before until not too long ago, and that is post-concussion syndrome. It turns out, Diane, and you know this, everybody that has a concussion or a traumatic brain injury, guess what? Every single muscle in the neck is involved, not in brain injury, but in the ability to move the neck. So irrespective of the degree of brain damage, the neck always has to be treated.
Yep.
So to treat a neck and a jaw really well is not easy. It's not simple. It's complicated and complex. And so what I like to do is be thorough in that respect. And I've had more people come back and say, you know, I'm treating more of the neck. I'm getting more results with what you've been showing me. It makes me combine everything I've ever learned, basically. And clients respond accordingly because they say, well, that's different than, that's a lot more involved than what I've been receiving. And, you know, it's difficult to have time for the neck and do the full body as well. You know that.
Right.
So take the time to do it. Neck and jaw are really incredible. So the other area that I would identify here that doesn't get much treatment in massage practice because of draping and so forth, and that is the glutes and the sacrum, the lumbosacral area. We go down often in massage to the iliac and ilium, and we stop there, or maybe we go over to the sacrum a little bit. But the beauty of someone wearing a pair of yoga pants and being on their side in a sideline position means that, oh boy, I have access to the glutes, the obliques, totally involved in back pain that never gets treated really well, the obliques and the glutes, and not to mention the IT band and the beautiful vastus lateralis muscle underneath it, which is the exact treatment that's needed. We don't treat the IT band. There's nothing we can do for that, but we can do a lot for the big old vastus lateralis there. And we have access to that in sideline position and can do a more accurate piece of work with the external rotators all along the sacrum. And we want to work that all the surface of the sacrum. Why? Because there's a muscle on top of the sacrum, one single muscle that's just dying for contact. Dying, literally dying. Shall I tell you what muscle it is, or should we offer a prize for the first person that calls in?
Wait, we have some people on.
What's the one muscle that covers the sacrum? There's only one.
Anyone? Anyone for a prize?
Anyone for a prize? That's a weekend in Philadelphia. Prize. Anyway, so those two areas I will identify. And, you know, for instance, on the jaw would be that you hear people talking about working inside the mouth. And the truth is that most of the jaw work that's needed for most of the restricted openings that happen can be done on the outside. It is not imperative to put on a glove and go inside the mouth.
Right.
You can work the tongue muscle, the hyloglossus fairly well, and the genioglossus a little bit better inside the mouth. But from external, you can certainly do the temporalis and masseter, which that's it right there, the two of the powerful closers of the jaw. Little tidbit. Oh, the muscle on the sacrum, that is the multifidus. Multifidus is all the way down the spine, but it's most prominent in the lumbar spine and then on the entire surface of the sacrum.
No winners.
Okay.
I guess I could have shouted it out.
We'll all be winners if we work it.
You gotta work it. It's worth it. So all right.
What else did you want to ask me?
I think that's all for now, Dave. I think we covered a lot of ground. We got a lot of comments. Everyone seems pretty happy. And if we don't cover everything this time, then you'll come back and talk to me again.
Do you have any questions? Anybody asking any questions?
No, just more like that you're awesome. They love neck and shoulder work. Rome wasn't built in a day. No, everyone's just making comments. Maybe next time you come with us, we could get a bunch of questions from the group.
That'd be swell with me.
That'd be fun.
Do you have any more time? Could I throw in one other little thing?
Please. Well, I'll sit here. I got plenty of time for you, David. Let's go.
This is about the neck.
Okay.
I saw a research study not too long ago that was talking about post-concussion syndrome and saying that what would you need to do to be able to be effective with some of the symptoms in the neck of post-concussion syndrome. And the research article indicated that there were 16 muscles in the neck that would need to be treated if you're going to do a credible job of helping someone with the neck as a corollary to traumatic brain injury or post-concussion. And that 16 muscles is exactly what we teach in our #1 course. Add them all up. I went through the whole list, and every single one of them is in our training. So what we want people to do is to know how to be successful with those kinds of symptoms. That is the rage these days in sports, with veterans, with incredible number of different populations. Geriatrics and all manner of folks are having injuries to their head or their neck, i.e. whiplash, all the way to concussion. Hit a wall and you've got a neck injury. The neck is delicate. Even your neck and my neck is delicate, but someone who's hit a wall have problems. And it's not going to be just a nice little rub in the back that does it. It's going to be thorough treatment of all of those neck muscles. So we all are really challenged, challenged to learn those things if we want to be successful with that. So that's my evangelical approach to this. Learn all we can and apply all we can. And I believe that this is the best job in the world. The greatest thing in the world is to help someone with their pain. And by golly, we're doing it. And I want to learn how to do it better all the time. And my clients teach me.
It's so true, right?
My clients are my teachers.
Greatest teachers, for sure.
Yeah. Such a pleasure to be with you, Diane.
My gosh.
You're a true colleague, and I really honor you and respect you a great deal.
And I honor you and I respect you. I'm so thrilled to have you with me. And I think you just agreed to come back, so that's pretty cool.
Well, this is my work, and this is my life, and as long as I'm alive, I'll come back.
Woo! All right, David. Everyone, I hope you enjoyed. David is just pure awesome. Check his stuff out. I'll go ahead and
may I say that on Facebook, it's search therapyedu.net. That's where we market our courses in medical massage therapy. We have an online class, the master class, followed up by a 4-day intensive with me to put the icing on the cake. Therapyedu.net. Search Facebook, and you'll see lots of videos there. And if you sign up, quote unquote, you give us your email, and we'll start sending you videos that let you know what we're about.
And I'm going to post all David's information so you guys will have it.
Thank you, Diane.
David, thank you very much.
You're doing a great service for the profession.
It's very exciting.
What you're doing.
Oh,
so
thank you. Thank you. Hang tight, David. Don't go away. Everyone, thank you very much. It was great to see everybody. I hope you enjoyed, and I'm sure you got something out of this. Thank you.
Blessings to everyone.